Hello, everyone, and welcome to Headwise, the weekly video and audio podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. We're talking today about some resources in the headache community for veterans and their loved ones. We are recording today from Washington, D.C., because there are two important events for the headache community occurring here. One is Headache on the Hill, and one is a listening tour for Operation Brainstorm, which is an event for veterans sponsored by the National Headache Foundation. I am lucky enough to be here today with someone who is new to our program. This is Dr. Jason Seco. Hello, Dr. Seco. How are you doing today?
Great. I'm so excited to be here. I really appreciate the chance to chat with you and to educate the audience.
Well, I'm so glad you're here. This is an important topic. We really wanted to get it on today, so you can tell, I'll make a joke out of it. If you're watching us on video, we have very similar backgrounds. We are both in the same hotel in our own rooms, recording via Zoom. So we're here today. We have Headache on the Hill this week. We have an awesome event called Operation Brainstorm, which we are going to discuss. Dr. Seco is the National Director of the VA Centers of Excellence program and a board member of the National Headache Foundation. He is the perfect person to talk to about the resources in our country and in our community for veterans when it comes to headache. So, Dr. Seco, enough of me talking about what you do. Why don't you tell us about yourself? Why do you do what you do, and what is it that you do?
Absolutely. Thank you. So, my name is Jason Seco. I am a neurologist with additional board certifications, both in headache medicine and brain injury medicine. And I am keenly interested in improving the care quality, the care delivery for veterans living with neurologic disease, especially headache.
Mhm.
I myself come from a family of veterans, grandparents, uncles. I have several cousins that are currently active duty. And even reflecting on some of the experiences with my grandpas, taking them to their own VA hospitals for their medical appointments, several things impressed upon me at a relatively early age. One, this commitment to service. I love the fact that in my job, day in and day out, wearing different hats, doing different tasks, I serve the men and women that have proudly served our country and served and preserved our way of life. And that I find such a deep level of appreciation in that, where I wake up every morning and I'm excited to do what I do. I'm blessed, and so are a multitude of people that work in the VA delivering headache care.
Mhm.
And they could be neurologists, they could be health psychologists, clinical pharmacists, nurses, physiatrists, physical therapists. And in a little bit, we'll get to a bit more about the headache centers of excellence and our approach to headache care in an interdisciplinary fashion. So I could tell you that the Veterans Health Administration had provided great care for a multitude of my own family members. And then having having been a part of the Veterans Health Administration in some ways since 2004, just really getting to know veterans year in and year out and their love for the VA, their love for their fellow brother and sister, but also they're again recognizing that they served our country. And in many
Mhm.
ways, they still continue to serve our country.
Right. Okay. Thank you. I'm so glad that you shared that with us. I think it's so important for us to know why you do what you do. That was actually very heartwarming. We all probably enjoyed hearing that. I know I did. So I think it's important that we all know what the particular needs of veterans and their loved ones are regarding headache disorders, because I think that there is an increased need in certain areas for this community. So can you tell us about that?
Yep, absolutely. And I'd like to do so in the context of thinking about my grandpa Siko, so my dad's
Mhm.
dad. He was a Korean War veteran and uh, wonderful man, and but in many ways sort of suffered after he
Mhm.
came back from service. And some of the little that he spoke about his time during war was that uh, when asked about his hearing loss, he said, "Well, I got blown up on the side of a mountain, and I was lucky to live." And since that time, he said that he had headaches.
Yeah.
And and as a teenager, adolescent, sort of seeing him with headaches sort of on a daily or near daily basis. And I could tell you they never really talked about it that much. And
Hmm.
in such a way, and when they did, he said, "Well, there's nothing that they could do for me." Now, granted, this was back in the 80s and very early 90s, and headache medicine has come a tremendous way in terms of the therapeutic options that we have.
Hmm.
But seeing how there were times that we have to cancel picnics or even trips down Grandpa's house, and then seeing him become more and more secluded in his home because he wasn't able to go outside or he didn't want to. He wanted to stay in his cocoon pretty much all the time. And sometimes I reflect now if Grandpa was still alive, or if the types of therapeutic options that we have for people living with migraine and other headache disease, if they were available to my grandpa back in the 80s, I think he could have had a different life. And I think part of it too is that and it was a very personal decision for him, but I find that sometimes veterans will not readily share that they're suffering. They'll not readily
Hmm.
talk about their headache. Sometimes it's because they don't think that anything can be done for them.
Right.
Sometimes they think that they have to suffer in silence. Sometimes people have shared with me that they've talked about their headache and didn't really get anywhere.
Right.
And oftentimes, and I think that those listening is that when we talk about it, sometimes we don't get the right person right off the bat.
Right.
Sometimes they don't really appreciate how headache and headache disease affects their life, affects family life, affects their ability to meaningfully engage with the world around them. One of the things that one of the messages I give is one of hope, that in the VA, there are lots of providers that will listen.
Hmm.
There are lots of people that will listen and listen to your story.
Right.
And that's really important. And sometimes opening up is difficult. I fully recognize that. One of the things that I also find that's helpful in the opening up is something that I think comes from a military culture in terms of the band of brothers and sisters helping one another out. And I found that veterans oftentimes will sort of open up more if they know that they're not alone,
Hmm.
or if they know that if they get help, they are improving their ability to be there for someone else, improving their ability to serve. So I think in terms of things that I've seen, especially among veterans living with headache disease, is that they shouldn't suffer in silence. They really shouldn't.
Right.
Being able to share, and it's okay to share that you're in pain. It's okay to share that you're suffering. And I find that oftentimes it takes a little while for them to want to do that,
Right.
and then to find the right person to do that with, and to find the person to do that with that could say, okay, well, these are the types of things that we could do together. These are a multitude of treatment options that we have. And these are some of so let's figure out what resonates with you, what resonates
Okay.
with your values, what resonates with your preferences. And then thinking about other things I think really important to be aware of among, especially veterans living with headache disease, but also people, healthcare providers like myself, that are caring for veterans living with headache disease, is that you have to look at the whole person.
Hmm.
So you can't look at headache as a symptom. You can't even just focus on headache. And what I mean
Right.
by that is that oftentimes veterans will have a lot of other mental or mental health comorbidities or problems that in order for us to give the best, highest quality care, we have to look at someone as a whole person. So if someone has insomnia and they're not getting great sleep, we know that that's going to affect their migraine and headache disease.
Right.
If I ignore their insomnia and sleep problems, I'm not doing them a service. I'm not doing the best that I can for them. We know that veterans have high rates of insomnia, high rates of traumatic brain injury, high rates of post-traumatic stress disorder, high rates of military sexual trauma, and other things that we need to talk about and understand and treat.
Hmm. Okay. That was a great answer. That was that was just very important for all of us to hear. I don't know that everyone truly understands that it is so difficult for veterans to talk about, to get treatment. We discuss this as a migraine and headache population as a whole, but we don't often hear the veteran side of the story. And is it not true that there is an increased prevalence of headache disorders in the population of veterans?
There absolutely, absolutely, and is both in men veterans and women veterans. And sometimes I feel that women veterans are sort of more in tune or understand about headache and migraine than men do,
Hmm.
than men veterans. And one of the things that we well know that a couple of things. First, that over the last decade or so, we've seen an increased number of women veterans,
Hmm.
and that reflects how and more women are serving in our armed forces. But
Right.
then, so one of the other things that we understand is that there's a lot of men veterans with migraine. In
Hmm.
fact, in the VA, among men veterans that get care in the VA, there's more than 1 million,
Wow. Okay.
and those are potentially 1 million people that can get better care.
Right. And I think that's important to bring up because men experience a lot of stigma sometimes when they have migraine because it's often considered a women's disease. So that's an important thing to bring up. We have a lot of listeners that may not be veterans. Is there a role that people that are not in the veteran community can play to help? What can people that aren't veterans or whose family members are veterans, what can they do?
Yeah, absolutely. So some of the things that we know across the board is that at least 15% of veterans that get care in the VA have some type of headache.
Mhm.
And I think that number is an underestimate. And
Okay.
quite frankly, I think it's closer to a third of veterans that have served our country have some type of headache. And that's a large percentage of people.
Mhm.
And some of the things that I think are important for broadly for our listeners to know is that headache can be more common among veterans,
Mhm.
and that there are that through the VA and elsewhere that there's ways by which they can get their headache treated. I think one of the many wonderful things about the VA is our approach to headache care. So, uh, so recognizing that we have things like the Headache Centers of Excellence program, we could offer interdisciplinary care. We could also offer telehealth across state lines. So
Mhm.
I physically live in Connecticut. At the moment, I'm in DC. And just this past Friday, I was seeing patients while physically in Baltimore. I was seeing patients in Connecticut, Colorado, and Florida.
Mhm.
And so veterans could access high quality headache care via telehealth, which I
Okay.
think is, and there's not some of the stipulations that we see out in the community.
Okay. All right. So what are the headache centers of excellence, and why are they so important to veterans? What is being done for veterans through these centers of excellence?
Excellent. So, as you mentioned at the beginning, one of the wonderful events occurring here is Headache on the Hill.
Hmm.
And the establishment of the Headache Center of Excellence was a really big win for veterans, as well as correspondingly a very big win for the headache advocacy community and
Hmm.
Headache on the Hill, and something that I know that hundreds of thousands of veterans are grateful for.
Hmm.
And so in 2018, Congress recognized, again, in part, in large part through the Headache Advocacy Group and Headache on the Hill, that headache among veterans is important, and that
Hmm.
that veterans oftentimes are underserved when it comes to their headache need.
Hmm.
And then also, and I think going back to the other point before in terms of what are the specific things to think about among veterans, we know that traumatic brain injury, that there's high rates of traumatic brain injury or TBI
Hmm.
among veterans. And depending on where you read, 90% of veterans that have a mild traumatic brain injury will develop headache. And
Right.
then a year later, anywhere from 30 to 50% will continue to have headaches. And typically they will have headache most days of the week, meaning they have most that they live with headache most of the time.
Hmm.
And so Congress recognized that TBI is the signature injury of OEF, OIF, OND, or the post 9/11 wars, and also recognize that headache is common, but also that migraine is common among veterans as well.
Hmm.
Furthermore, they recognized that at the time there were only three healthcare providers that had additional headache medicine certification. was one of those three. And I could say that because of the headache centers, we now have 25, and that number continues to grow. So, but also, again, kind of reflecting on some of what we talked about, where oftentimes veterans will have post-traumatic stress disorder. They will have cognitive concerns because of their migraine or because of their traumatic brain injury. And really being able to oftentimes take a team-based approach to being able to provide the best, highest quality care for veterans living with headache disease. So I'm a neurologist, and I don't know it all. No
Hmm.
neurologist does.
Right.
And I think that's important to recognize that, for me to do the best that I can to provide the best service to that veteran sitting in front of me, either in person or over on the screen, that oftentimes it takes a team-based approach.
Hmm.
So the headache centers embrace that interdisciplinary team-based approach to have health psychologists to offer non-pharmacologic treatments and behavioral interventions, including things like biofeedback and cognitive
Right.
behavioral therapy. We also work closely with clinical pharmacy specialists and in such a way to help make sure that people understand the medications that they're taking. Because oftentimes
Right.
people are on a lot of medicines, and
Hmm.
how are they taking them? Are they taking the right way? Are they working well? But also being able to help help people come up with tips and tricks to be able to take their medications in a way that fits most into their lifestyle.
Right.
Uh, Physical therapists and physical therapists, recreational therapists, occupational therapists. Uh, One of the things that I've learned a lot over the last couple of years is sort of one of the mantras that we see in rehabilitation medicine is restoring function. And
Okay.
I think that's an important concept. So how could we treat someone's headache disease so that they could do what they want to do? How could
Okay.
we treat their headache disease so that they can meaningfully interact with their friends, their family, their loved ones? If they want to go fishing, how could they go? How can we make sure that we restore their function so they do the things that they love?
Right.
And
Which is the whole point of getting better so that we can live our lives, right?
yep, amen, amen.
Right.
And and those are some of the things that we do in the headache centers. We offer really high quality clinical care from headache medicine experts.
Hmm.
We make available a team based approach for people with some of the most refractory types of headache.
Hmm.
But also between 2008 and 2022, almost 2 million veterans received care in the VA for different types of headache disease.
Okay.
We currently have 19 headache centers across the country, and we're growing that number.
Hmm.
But the idea that a center could see all 2 million people won't happen.
Right. Right.
So we well recognize that education is hugely important for primary care providers, other neurologists, other healthcare ones.
Hmm.
How could someone, and one of the things that we do in the headache centers in conjunction with the VA's whole health initiative is to be able to foster self-management skills as well as make widely available complementary integrative health modalities. So
Okay.
oftentimes with the patients that I'm seeing, you know, we may start them on a CGRP inhibitor, and they're doing cognitive behavioral therapy, and we get to the point where they're also doing a graded exercise program, whether that may include one of the complementary and integrative health modalities like yoga and Tai Chi.
Right.
So, but again, sort of being able to say these are all the options. These are the things that we think could work well.
Hmm.
But what are you ready for? What resonates with you? What resonates with your values? What resonates with your preferences? And be able to come up with a treatment plan that is uniquely theirs.
That I love that. My which our viewers have often heard me say that my theory is you have to build a rock wall against migraine, chronic pain, headache disease, and that half the rocks are medicines, half of them are lifestyle factors, and that the mortar that holds it all together is your mentality. And you can't just do one of those things or your rock wall falls apart. And so to me, what you're saying is that these headache centers of excellence really help veterans build that rock wall, like they have everything they need in this one place. And I love that idea. It's pulling everything together that they could need for to help them live their lives normally and help them get their pain levels down and help them get better.
Uh,
um
Absolutely. And along those lines, we will recognize that that migraine and headache disease, they're complex chronic diseases.
Mm-hmm.
And there's lots of things that could cause them. There's lots of things that could trigger them. There's lots of reasons as to why people may have them. And sometimes it's wonderful if we find one therapy and that does the trick, but oftentimes we have to have different approaches. And
Right.
the added bonus is that by having that multimodal approach, we're also helping them become healthier people.
Mm-hmm. So what is Operation Brainstorm, which is the other event, the other resource for veterans that we were going to speak about today? It is a National Headache Foundation initiative. What is it, and what does it have to offer veterans?
Yeah, and I think in many ways the name itself shares a lot of what we do. So
Mm-hmm.
we are on a mission, we're on an operation to brainstorm with veterans and active military personnel to understand how what's it like for them to live with headache and migraine disease.
Mm-hmm.
But even beyond that, what things have worked really well that you think could be replicated that we could share as best practice and lessons learned? What are
Mm-hmm.
things that haven't worked well? Why didn't they work well? And
Mm-hmm.
how can we improve on it?
Mm-hmm.
And so one of the ways I think about this is that it's a listening and a learning tour.
Oh,
We want to
okay.
make sure that but really, and even going through some of the messages that we talked about before, where they're not alone.
Right.
There's help. We live in a time where there's been an explosion of therapies for people living with migraine and headache disease. But also, we're living at a time that I do believe that stars align, and
Mm-hmm.
I think that it's really wonderful and serendipitous that and fated maybe that the headache centers came out at a time when there's been an explosion of therapies, because we
Right.
have more and more things to offer veterans living with headache disease. But
Right.
how do we do that in such a way that we're learning from people, metaphorically and at one point in time physically in the trenches? How do we
Mm-hmm.
learn from people that live their lives day in and day out, and with the goal of how can we do things better, and how
Right.
can we learn from you, so that the thing that worked well for you we could share, and the thing that didn't work well we could brainstorm together to understand how we can make it better.
So are these events open to all veterans,
Correct.
these
Yep.
listening tours? And how many are there going to be? There is one in DC this week. We are recording right now on in February. The event, I think, is on February 13th. Are there more in the future?
Correct. So one slated for Nashville, one is some ones that are upcoming include those in Chicago, Houston, and a few others. And then we keep updated the National Headache Foundation webpage in terms of the locations. And some of the nice things about these are they're open
Mhm.
for veterans, their friends, their families, their caregivers, active military personnel. It's
Wonderful.
free. People just have to register ahead of time.
Okay.
They could submit questions beforehand or have questions answered there
Oh, okay.
from headache specialists like myself.
Oh, that's wonderful. So it is difficult to get into and talk to a headache specialist in this country. So this is an amazing idea, an amazing event where you can get your questions answered and have access to a headache specialist. And so go to headaches.org to learn about it. That's the National Headache Foundation website. And to learn where these events are going to be at and how you can register and get in. What else do you think veterans and their loved ones need to know, or even people who may not be veterans but want to help?
Yeah, absolutely. So there's so much that we could learn from you. We meaning one another, healthcare systems, providers, and uh, so I'm a big comic book fan. I've been reading comics since I was 5, and every year I sought out Santa for some superpowers. Um, I think he brought me one where I get to serve people that have served their way of life. Sometimes I wish I had telepathy, so I could
Mhm,
read someone's mind to understand the types of things that they may not want to share, may not feel
mhm.
comfortable sharing, or may not even think to share. And when it comes to understanding migraine and headache disease, sharing your experience, sharing the types of things that you feel. I have to tell you that oftentimes when I'm seeing veterans in clinic, I'll start off by asking, how does migraine affect you?
Mhm.
And then keeping it open-ended and letting them to set the stage. and and share things that you think that in your mind you may not think make sense. So I'll give some kind of an example. So just a couple of weeks ago, saw a veteran and had asked and had been refractory to several therapies, and then asked, well, are there things about your headache that you haven't told anyone that you've thought about sharing? And they're like, yes. After like a little bit of pause, and you know, whenever I get them, like my eyelid closes shut and I get a really runny nose. And we
Mm.
explored that a little bit, and you know, they have cluster headache.
Oh gosh. Yeah.
And in fact, a week later, and had shared that, hey, around such this time every year, I start getting headaches, and uh, we started him on therapy, and he's doing great. He's
Wow.
doing great, and so another veteran that I saw a couple months ago shared that the headaches always start at this time and always end at this time, every single time. And they're always on one side, but he never shared that they start and end at the same exact time. So in discussing things a little bit, he had hemicrania continua, and he had
Mm.
tried many, many treatments, him on indomethacin. And within 2 weeks, he went from having headaches every single day to not having a headache at all. So
Wow.
so it's really fantastic to be able to help veterans and make those right diagnoses. And so, but that wouldn't have happened if people didn't share some of the things that they thought they shouldn't share, or that just seemed odd or unusual.
Right.
Sometimes those types of details could be really important when we're trying to make the right diagnosis for someone.
I think that's an important advice. Share things that might not even make sense, and I think an important component of that is you have to find a healthcare provider where you feel comfortable sharing things that won't make sense, especially if you've experienced, people not believing you, et cetera, in the past. So that's great
Absolutely.
advice. So thank you for that. Thank you so much for being here. This was a very important episode and a heartwarming episode. And thank you everyone for joining us today. And please join us again next week on the weekly video cast and podcast of the National Headache Foundation. Thank you so much.